from the European Parliament here, we're having a Euronews debate on the future of healthcare and what we learned from the COVID crisis and how we can future-proof healthcare across the European Union. How much do we unify our efforts? How much are they sort of national responsibilities? That is what we're going to be debating today. Let me introduce you to the four guests. Tomislav Sokol, MEP from Croatia. You are on the special committee on COVID-19 pandemic lessons learned and on the Committee on Environment, Public Health and Food Safety. Also is Cyrus Engerer, of MEP of Malta, Committee on the Environment, Public Health and Food Safety as well. And you're on the Parliament's co-chair on the Coalition for Mental Health and Well-Being. We're going to be talking about that as well. Also, Martin Smatana, welcome. Martin Smatana, Associate Fellow GLOBSEC think tank in Bratislava. Thanks for schlepping all the way over here. Appreciate it. And you're an ex-Slovak health ministry official. You're also advising the Prime Minister right now on health issues as well. And Josef Figueras, Director of the European Observatory on Health Systems and Policies here in Brussels. That was just a bit of a stroll for you. So, Tomislav, can you tell us what two key issues are on the fallout since the COVID crisis?
So when you speak of COVID crisis, in the beginning, obviously there was a big problem. So there was lack of coordination, closed borders, export restrictions. So some member states didn't want to export medical equipment to those who needed it most.
That's right.
And that was a big problem. After that, when the European Union stepped in, when the Commission stepped in, but also us, the legislators, things started to improve.
My biggest, let's say, a critique would be that I'm absolutely happy that something like a health union, well, was created and it's moving step by step.
Right.
But I think it should have been more, let's say, ambitious and go into other areas which we know that are going to cause problems, which is, first of all, shortage of human resources, doctors and nurses, which is soon, within a couple of years, going to be probably the same problem as we've had with the COVID.
Now is the time where we're seeing that there is like a section of the population that will probably never be diagnosed because they have passed away. If you see people who are over the age of 65, 70, who would have been diagnosed with unfortunately, some kind of cancer or other critical illnesses, probably, and we're seeing it right now, we are seeing a gap.
Mm-hmm.
Who is that gap? Who are those people? And what we're learning today is probably it is people who have passed away because they were not diagnosed.
So it is a ticking time bomb for a lot of other people, right?
It is.
What about, how much did we fail in dealing with the COVID crisis? Because we can't afford to fail again, can we? We can't afford to have another crisis like this. What else needs to be fixed?
We all believe in digital. But you said it, is the human resources, is the training, is the culture, the incentives, the regulation. Yeah. It's not just putting money into new digital tools and gadgets and infrastructures. Is when you look at which countries have uptaken digital telemedicine, it's not necessarily because more infrastructure, it's also the culture of the health system. So we need to use these resources very wisely and particularly with the health workforce.
Everything is interlinked. We're mentioning the workforce, for instance. The European Union is losing out on talent because when it comes to getting more nurses, more doctors, more healthcare professionals to the European Union, and we need so many of them, we have a system which is blocking these people from coming to the European Union. And what are they doing instead? They're going to the United States, they're going to the United Kingdom, they're going to Australia, Canada and Japan.
Inequalities which exist.
Yeah.
So inequalities are a big problem because if you look at, especially towards the east, you see worse health outcomes, you have bigger mortality from different diseases. We worked on the Europe's Beating Cancer Plan and the Parliament's report where you can see there are 30 or 40% bigger chances of dying from cancer in some countries of Eastern Europe than in Western Europe. So these are things which need to be addressed.
You're watching this Euronews debate here in the European Parliament on healthcare. How do we fix it across the European Union? And try to keep in mind the hashtag Euronews Debates for any of these sound bites that you hear that you'd like to cast wider?
Every single citizen in our European Union has a right to healthcare.
Yeah.
And I think that needs to remain. And I'm always a bit afraid when we discuss healthcare insurance, paying upfront and then getting refunded. I believe that healthcare should be free for all.
We are singing from the same music here, but the reality is very different, let's face it, okay? So who's going to pay the bill for patients from the East being treated in Germany or in the West?
And maybe this could be part of a European Health Union, as we're currently discussing out-of-the-box ideas of how this could work. But in reality, we could have areas of specialization in different parts of our union where we can have patients from all of the European Union having rare diseases, for instance, to go in these specialized places. It could be wherever.
I propose creating something like this, maybe not one hospital, one center of excellence on the European level, but maybe on a regional level, for instance. So if you have Croatia, Hungary, Slovenia, Austria, all within 30 or 40 kilometers, it's crazy to have 4 different specialization centers for a certain type of cancer. So why not having one, but then create a pathway, organize the system whereby health insurance funds from all these member states will make a contract directly with this hospital and send patients there.
What about taxation? There's another financial aspect. A sugar tax, a fat tax.
Why wouldn't we sort of tax fizzy drinks? Why shouldn't we do that? Of course, we want to have schools regulation that access, which has been done, and the European Union has played a key role, access to kids to good, healthy drinks.
Right.
But you have to combine all these elements. You cannot just say one or the other.
What we can do is regulate excise duties and VAT. And this is what we have been doing, especially with tobacco, and it has proven to have results. But we have to be, so indirect tax, but we have to also be careful, because if you go too far into the taxation, even indirect taxation, you can also create a black market.
The EU wants a tobacco-free generation by 2040. How do we do that?
Well, with regards to tobacco, if we're going to go specifically there, I think we need to first of all look at harm reduction. Now, I'm not saying that alternatives to tobacco products are something good, but let's start reducing harm. And we need to start pushing towards that.
So you mean e-cigarettes?
It could be cigarettes, it could be others.
The alternatives, if they are promoted in the right way, can really help people transfer from smoking a cigarette, which is much worse, to this. And
then to nothing.
Yes. But what we have to do, obviously, is to prevent this to become also an entry point for new generation, for children, etc. That means prohibiting targeted advertising for children.
So I agree as harm reduction, but we are not doing very well regulating it or making it accessible to only those who need it. For instance, shouldn't we have it by medical prescription?
Can we have a quick round-robin final thought? What is the one thing that you would like to see done to improve healthcare today? Let us start with Martin.
I would be very happy if the health union would make further steps and be a bit more ambitious and prepare within a year, maybe 2, a joint human resources sustainability plan for Europe, for all countries.
Perhaps COVID has the silver lining that you are saying all the time, to be able to make our case much stronger. The evidence is not there. If anything, we see the member states cutting health budgets. But I think we're failing to portray health as an important investment, not only as an element, a core element. We talk a lot about economy of well-being these days, as a core element of well-being in itself, but health as well. We call it health for all policies. Health as important for education, health important for the environment, health important for gender equality, health important for productivity. Perhaps we can, in this moment, is a good moment to call for more investment in health while justifying as value for money, thanks to COVID somehow.
The crucial thing here in Brussels bubble is to maintain the momentum on health. So this is actually related to Joseph said. I think so that's crucial, to really maintain this in the center of the debate, and because you cannot do anything without the political will.
Without a healthy population, without a healthy environment, without a healthy biodiversity, everything else is irrelevant. So we really need, and I agree here with Joseph, we have to really put health at the center of our discourse. We need to invest in health policy. We need to invest in working together.
Cyrus, Tomislav, Martin, Joseph, thank you very much for joining us. Thanks to all of you for watching us. This was a Euronews debate on the future of healthcare here in Europe. If you heard anything you'd like to cast wider, please send it out, #Euronews Debates. My name is Chris Burns. See you next time.